community. And so why is that important? It's important because these are preventable disease with different outcomes that are experienced by different populations. And so when things are preventable, we want to be able to work toward that. For example, if a Black woman has a baby and a white person has a baby, the chances, and they are the same age, a lot of other factors, the Black baby has a greater chance of dying than what the white baby would have.
And you know what, and you look at that, because I just did a special on the Black maternal crisis, and that very issue, in talking with an OBGYN, a local OBGYN, about that very issue. So that is one, and when they start talking about that, and again, she said the same thing, is that, you know, so many of these cases, the majority of these cases and situations are preventable. And so that's one. And then we talked about, you know, things like high blood pressure, things like diabetes, all these types of different conditions that are so prevalent in the Black community. But the outcome is so much different.
That's it. And because of that, we want to educate our people of things that we can do to prevent some of them. So that is one of the main reasons that we wanted to do that. And plus, we wanted to have something for the entire family at this healthcare conference. We are planning to have a faith-based lunch panel discussion at lunchtime, where we focus on health and wellness events within the Black community.
And let's talk about that. You know, you're going to have a panel discussion, and tell us about your speaker and a little bit more about this discussion.
We are very pleased to have as our speaker Dr. Angelina Howard, who is the founding assistant dean of the online education and the expanded programs at Morehouse. So to have her here to be able to give us great educational information, and to be able to see her as a female in a leadership role at a university is inspiring, but also informative, because we don't know who is in our audience who may want to emulate her.
Right, and follow in her footsteps, so to speak. And let's talk about a little bit about, give us kind of the rundown, you know, of, again, when it starts, where it is, and what people need to do if they're interested in attending.
Okay. It starts on June the 10th from 8:30 until 4 o'clock in the afternoon. And we will have lots of events, again, for the whole family, which will include breakout sessions. We'll have them in the morning as well as in the afternoon. We're planning to have Jay Armstrong, who is a local counselor, and he will be talking a lot to our youth about mental health, and about emotional trauma and physical trauma. So that will give us an opportunity for youth who may be experiencing some of those mental health issues to be able to get appointments with him if they need to.
And that's another issue that's so important, that when we talk about the Black community, is mental health. We've seen an increase in the rise in the number of suicides from young Black teenagers, in particular young Black teenage males. So there is a real need for help, for assistance, for awareness, for action when it comes to mental health in the Black community. Because again, it's great that people say to see churches now finally come out of the shell to say, let's talk about this. Let's get help for this issue. We say a lot of times in the church, it's something, you know, they would say for everything, pray about it. Well, you need to pray about it, but you also need to get professional help for it as well. And that's what you all are saying here. So again, we want to invite everyone out here, and at New United with the Health and Wellness Ministry, and you know, and I work with you all. It's important to make sure that churches get outside the four walls.
Absolutely. And that's what we are intending to do. This conference will be in the community at Brainerd High School, and we are encouraging everyone to come. CHI Memorial is having their
Lung screening?
Yes, their lung screening. And for people who have been smokers for 15 to 20 years or any number even
right,
greater than that,
there.
you would want to come and get screening, even though you may not have symptoms, or but if you smoke 1 to 2 packs per day, you would want to come and get the screening.
And it's so important to do that, and we want to make sure that, again, inviting everyone out there to Brainerd High School, to the new United Missionary Baptist Church Health and Wellness Ministry, and that's taking place again from 8:30 until 4.
Correct.
Debbie Johnson, thank you so much for
You're
being
welcome.
here today.